If symptoms persist after 3 days, consult your doctor. This does not apply to pregnant women, and I will tell you why. You see, there are some symptoms that pregnant women would observe and they need to act fast. And by act fast, I mean they need to present to the hospital immediately for evaluation and proper care. Stay tuned to know these symptoms that I'll be talking about. Number one is bleeding per vaginal. Let's just say vaginal bleeding in a woman who is pregnant. So, bleeding per vagina in pregnancy could range between spotting, which is like mild bleeding per vagina, to frank bleeding per vagina. And the age of the pregnancy will go a long way to determine what is causing it and how it can be managed. So if a woman is bleeding, a pregnant woman is bleeding, and this is happening before the age of viability, which in Nigeria is around 28 weeks, we'll say that she's having a threatened miscarriage, right? Which people would say threatened abortion, okay? But if she's having this bleeding after the age of viability, or let's say after 28 weeks, there could be a lot other causes or other terms we can call it. So in that instance, we can say she's having an antepartum hemorrhage, so which is bleeding way before the onset of labor, right? It can be caused by either a low-lying placenta or a sudden detachment of the placenta from where it's supposed to be. So it's a symptom that is life-threatening, of course, for the growing fetus and the mother. So a woman who is bleeding per vagina should report to the clinic or to the hospital immediately. Reduced fetal movement is an important symptom that should never be ignored in a pregnant woman. So a pregnant woman notices that her baby is not moving, as frequently as it should get to the hospital immediately, because if something is not done, it could actually progress to intrauterine fetal death, depending on what is causing it. Intrauterine fetal death simply means that the fetus in the womb dies. Inside, uterine, uterus, fetal, fetus, death, right? So, and importantly, it's good to know, how often should a fetus move, right? We can say that 10 times in roughly 2 hours. So if a woman observes that, this movement has reduced, please see your doctor immediately. One symptom that should not be ignored in pregnancy is painful urination, and I'm going to tell you why. Painful urination could be an indication of a urinary tract infection. So if you notice that you're having painful urination, do well to visit your hospital immediately so that you can be checked for a possible urinary tract infection. So let's briefly discuss the importance or the implications of having an untreated urinary tract infection in pregnancy. Because this infection is in the urinary tract, there's the risk of this infection, right, sitting properly in the kidneys and leading to a kidney infection. Aside that, this infection can spread to other systems in the body and could lead to overwhelming sepsis in the pregnant mother. The effect of a urinary tract infection, if left untreated, does not just stop with the mother, it can also affect the fetus. It leads to this fetus coming down with, a low birth weight at birth. Also, not forgetting the fact that it could actually also lead to premature uterine contractions, meaning that a pregnant woman who has a urinary tract infection that is left untreated, is at risk of going into labor prematurely, and you don't want that happening for that precious pregnancy of yours. So make sure that if you observe such symptom, you go to see your doctor immediately.